it's definitely a good segue after we reviewed all the different disorders, right? The perinatal mental health conditions, to segue into the importance of screening and what the screening tools are, so that you can feel more prepared and confident, most importantly, in providing this screening tool. So something important that you should know, because we're all here in California, Maternal Mental Health Now work really diligently with other professionals at the legislative level to pass two different bills back in 2019 and 2020. And these were AB 2193 that requires OBGYNs, nurse practitioners, physician assistants, midwives, naturopathic doctors, and also licensed midwives to screen for perinatal mood disorders, okay? And also orders health insurances to develop maternal mental health programs, so that the goal is to promote quality and cost effectiveness resources. I feel like there's still a lot of work to be done around that. Then a couple of months later, the beginning of 2020, AB 3030 was passed, requiring all birthing hospitals in California to provide education and information to the postpartum people and also to their families about mental health conditions, post-hospital treatment options as well, and community resources. They were also requiring that all regular staff in labor and delivery departments receiving education and information about mental health disorders, which I think is super important. And the last one will be for hospitals to also develop additional services to ensure optimal care. And I know you probably have felt some of the partial government shutdowns, the different cuts that had happened at the federal level for federally qualified clinics or other institutions. This is going to be adding a gap for birthing persons and families to receiving the optimal care that they deserve and that they need. Checking on their emotion temperature. I love using this phrase because it's really about checking in with the family, making sure that we're there to hear them, but also validate, normalize some of the feelings that they're and symptoms that they're experiencing, but most importantly, that there is support available, okay? When you're using these tools, you're going in with the openness to check in with the parent and just to see how they have been feeling in the last 2 weeks, or since last time you checked in. This is not a diagnostic tool. You're not going to be there to say, oh, well, based on these results, you are presenting mild depression or you're presenting severe depression or anxiety. This is just information for them to know that, okay, I can see why you've been feeling or your symptoms have increased since last time we connected, okay? This is just an opportunity to begin a conversation even with the parent. Why? Because it's an intervention. Screening is an intervention.